Hello, and this is a talk about education in the Children's Emergency Department. It's aimed at junior trust grades, FY2s and CT3s. It's a little bit about how to make the most of the educational opportunities in this department. Our training is based on the joint curriculum from the RCPCH and RChem for PEM. And we use a blended learning approach, shop floor and experiential, face-to-face, online and interactive, and simulation training. What this means is obviously we know that you learn stuff by doing stuff, and that's fine. But there are a range of resources that are there to help you learn and to support you in your education. The way we work our teaching programme out is we take the topics from the curriculum and develop it into teaching. It's quite simple. The main components are shop floor teaching, the PEM weekly teaching, the simulation teaching, and the EM3 in the PEM website. There's also the Critically Careful Forum, competency shifts. Now these are shifts where you can be watched doing something and get feedback on how you're doing it. And Slack. Please email Gareth about being on Slack. So all of the above will be linked to and advertised on Slack. It's a really great way to get involved because everybody can talk and comment and chat to each other. So please do email Gareth. Of course, there's still support for regional teaching. If you want to go to that, you'll have study leave. There may be annual PEM training days, and if you're interested, you can go to those. And there's CBD clinics, which you can book onto. The PEM teaching programme is Tuesdays at 1. It's remotely hosted and supervised by an allocated consultant. It's aimed at the PEM subspect registrars, who are given allocated topics, and should post everything on Slack afterwards. It's currently not videoed. For you guys, it's not mandatory. If you want to go, then that's great. You may well get something out of it. But if you choose not to, then that's also fine. EM3 is online VLE for the whole of the East Midlands. It's got loads of content and you can really choose what you need. If you feel like you want to make a contribution, then you really are welcome. Everybody gets involved, and the more stuff we produce, the better it is. In terms of simulation, there's Monday morning surprise in situ simulation. Only now I've spotted the surprise. You do that in your role. It's multidisciplinary and based on real cases. We aim to get the whole team involved in this. Of course, some of our nurses and some of our other staff can be a little bit sim shy. If you feel like that, don't worry, we'll support you through it. We also have bookable sessions on Wednesday. Now, this is really useful if you need to tick off a particular skill or you want to develop a particular aspect of your practice. You can get somebody to go through it with you and feedback to you. And so I would really encourage you to book on to some of those. The PEST day happens 2 to 3 times a year. This is a whole day of simulation and it's based around human factors. Looking at the way that we interact with each other as a team, how we talk to each other, and how it all works. We try to get people from other teams to come and join us because realistically, when we're dealing with really sick patients, it's not just about what we do, it's about what everybody does. It's usually held in the Skills Lab, but we're working out ways to make it more COVID friendly. Because it's all day, you can book study leave to come. However, we do try to release people from the shop floor. You could consider taking part as faculty, depending on your level of experience. Critically Careful is a monthly meeting, which is for everybody. So the entire team, medical and nursing, HCAs, everybody gets involved. It's a combination of mortality and morbidity, quality and safety, and our interesting and challenging cases. It's an overview of all of our activity, not just the things that didn't go well, and it's got an educational objective. It's currently hosted on Slack, but we may try Teams. All of this is to supplement your programme, so the FY2 teaching and regional CT3 teaching, and of course they'll continue. All of the other stuff is optional, but it is there to supplement your learning, so to allow you to develop new skills, and most importantly, to allow you to treat your patients safely. If you feel you're lacking in an area and you feel a little bit uncomfortable, then there's all these educational resources to help you develop. So please do make use of what's there. Other things to consider. So obviously you will need to be involved in QI of some kind. For audit, you need to contact Habab Meki. Guidelines, Amy Atkinson or Alistair Moffat. For research, Damien. Now, I would suggest that you all get your GCP, your Good Clinical Practice Certificate, because this is what allows you to recruit patients. We are definitely research active, And so if you get this, you can really get involved. You can get on the delegation log. It is easier than you might think. Okay, so please ask us about this. If there's other projects, any burning desire to do something, or you just think, you know what, I've seen that done better somewhere else, then just ask one of us. We're all available via our trust email, and we're also available on the shop floor. As a group, we are approachable. So there are things that will be mandated by your college, and we want to support you get through that. You'll have a supervisor. Please do use them. Book your appointments early. That will allow everybody to function better. There are bookable workplace-based assessments on EM3, things like mini-CACSs and CBDs. And if you plan ahead, you can spread these out nicely throughout the year, so it's not too intense. Obviously, you'll all need to do an MSF or a TAB and a portfolio review. Please note, it's a little one driving here. This is about your training. You know where you've come from and you know where you're going to. We know that you all have different needs, but we won't know what specifically yours are unless you tell us. So sitting down and having that meeting with your educational supervisor or your clinical supervisor in the beginning is really, really helpful because it's your training and we are just a support team. We really always want to improve, so you can email Gareth or myself with comments or suggestions. Please do email Gareth to get on Slack. You'll get a lot more out of this placement if you do that. There's loads of stuff on there, and definitely some of it will be relevant to you. We really look forward to working with you, and we'll see you on the shop floor.